thanks very much for taking a few minutes to meet with me. I'm really looking forward to hearing more about your company and what you're doing in Latin America. 17 countries in Latin America, 650 million people. You're developing a telemedicine solution there. What's really unique about creating a solution like that in a region with so much diversity and so many countries?
Well, thank you for having me. That's a great question. The problem in Latin America is access to healthcare is really complicated. So we're working on a solution to provide instant access to primary care. So instead of taking from 1 to 5 days to just talk to a doctor, you can go to our platform and just be talking to a doctor in less than a minute. So that's like a leapfrog solution that we're developing in the region, and we're trying to just bring more alternatives to the population in Latin America, because as you mentioned, it's very diverse, but it's something common. It's just only 5% of the people are able to afford private insurance and have some good access to healthcare. So the other 95%, they just have to deal with whatever is available, and our solution is actually trying to help them get instant access, solve their problem, and if they need an additional care, our doctors, our team will tell them where to go and how to do it.
So I imagine that the access to care is cost prohibitive in many ways, not just the cost of the access. You mentioned how many people have private health insurance, but also the fact that many of the workers who don't have insurance also would need to take time off and not get paid for that time. So they're spending money and losing money at the same time. So that's something that will be addressed through being able to access care through your system?
Yeah, that's exactly the situation. And in our case, we sell our platform as a benefit for corporates. So they're actually addressing just that problem, reducing absenteeism. By providing instant access to primary care, actually people won't have to go for a day or even two to just talk to one doctor. They can do it on our platform in a minute, and everybody's saving time and money. And most importantly, they're also living a healthier life, because it is so important to talk to the right person at the right time. And that's what we are allowing to, not only talking to doctors, but also mental health is becoming a big issue everywhere in the world. And we're doing also that, mental health services and nutritionists. So it's kind of an instant access to a comprehensive solution when every part of your health is involved, and you're able to do that just from your phone, from your hand.
So you just mentioned something I was going to ask about, which is you said it's a platform. So what is the platform? Is it through smartphones? Is it laptop and tablet based for the doctor and healthcare professional?
Well, it's our platform can be used from our app or even from our website. It has two ends, one for the patients, one for the doctors. Basically what we do is we connect them instantly, so we kind of manage the demand and supply of the platform. But we're right now able to serve around 120,000 consultations every month. So we have enough supply and enough demand on the platform, and we are expanding into different countries. Right now, our main market is Mexico. We were born out of Colombia, but our main market is Mexico. We're going deep into Peru, Ecuador, and some other markets in the region with similar conditions, and huge opportunity to improve access.
So what's the response been like from healthcare professionals that are using this?
Well, the response has been great. We are a optimal option for healthcare professionals, because they know how many time they can spend on our platform. It's pretty well paid for them, and in the end they're able to somehow help more people. Our doctors, because of our technology, also are able to see more patients per hour than any other platform.
So what's next for you as we come out of the pandemic and we go into the new normal? What do you think? What can you tell us is next for you?
Well, of course, like any other telemedicine platform, we had a great push in terms of adoption, patient adoption, payer adoption. Regulation is no longer an issue. So what we're doing now, it's growing as fast as we can, bringing more corporate clients. We're bringing big corporations, big names into our customer base. What's coming next is to accelerate growth. We're planning to cover 1 million people by the end of this year. Right now we are around 200,000 people covered by our platform. So that's still 5x, and keep on adding more services and building this ecosystem where you don't only have your consultation, but also if you need labs, you can get them. If you need a prescription, you get it, and also get your medications delivered to your place. If you need a doctor at home, you also can get them. So it's kind of a comprehensive solution that allows corporates to provide a benefit that has a lot of impact in their workforce, that is tangible, but also is quantifiable for them, because all data all the data is tracked, and they know how many people are using it, how many people are actually not being absent because of the healthcare issue. So it's a win-win situation for everyone, and we're just focusing right now on growing and getting our product to more companies. The usage rate is great, and also people are kind of rating 4.8 stars out of 5 of our service. So always patient in the middle. That's our focus, to better help patients and help them save days, weeks, many hours of waiting time in emergency rooms all across Latin America.
Who's largely taking this up in terms of the age population or demographics? Is this something that adult children are buying for their parents or making accessible for their parents? Or is it something that the workforce is using, or students?
Well, actually, it's paid by the company to the workforce, but they are able to add 5 relatives. Could be their parents, could be kids, because the whole idea is to have the whole family covered, because it's primary care, so you don't know where you need it, but you might need it anytime. So we're always ready for not only for the employee, but also for their families.
Excellent. Well, I really appreciate you coming by and sharing what you're doing. Wish you a lot of success, and it's great to hear the impact that you're making on people's lives. Thanks for being here.
Thank you, Dan.